All right, hello everyone. Welcome to today's webinar on raising awareness and developing disability cultural competence in the supervisory relationship. My name is Kristen Dempsey, and I'm the Assistant Director of Professional Psychology Programs in the Education Directorate here at APA. Thanks so much all for joining in today. Before we begin, let me mention a few housekeeping details. Today's webinar will be 1 hour. For anyone who would like to follow along during the presentation, you can find a copy of today's transcript under the Handouts pane of the control panel. You'll receive an email with a link to view a recording of today's webinar on YouTube later this month. You'll have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the webinar, and we'll address them during the Q&A session at the end of the presentation. So without any further delay, please let me join me in welcoming our three presenters. Dr. Rebecca Wilbur is a licensed clinical psychologist on staff at Legacy Good Samaritan Medical Center in Portland, with specialized training in neuropsychology and rehabilitation psychology. Dr. Angela Kimmel is an early career rehabilitation psychologist in spinal cord injuries and disorders, and the Assistant Director of Psychology, Training, and Education at the Louis Stokes Cleveland VA Medical Center. Dr. Eric Samuels is a licensed clinical psychologist with a private psychotherapy practice in downtown Oakland and the Castro, and an adjunct professor at the American School of Professional Psychology at Argosy University in San Francisco. With that, I'll turn it over to you, Dr. Wilbur.
Thank you. We're very happy to give this lecture. We appreciate APA's public interest and the APA Education Directorate in their support of cultural competence and including disability as an important and valuable aspect of diversity. Dr. Kimmel and I started this work at the Louis Stokes Cleveland VA and quickly found a real need for further education and support in this area. We did a research project to learn more about the current state of psychology supervisors and their knowledge and awareness of disability and disability-related issues such as the Americans with Disabilities Act, also known as the ADA, as well as reasonable accommodations. Since we began presenting our findings, we've received great reception from the training and supervision community and recognition for the need for more opportunities to grow awareness in supervising trainees with disabilities. We feel it is important to review our learning objectives and provide some context for our presentation. Our overarching goal is to reduce bias and harmful practices in education and reduce healthcare access disparities for students with disabilities. Our objectives will increase supervisors and educators' awareness of disability, discuss the basic terminology on disability issues, understand the unique challenges and socio-political concerns that trainees with disabilities face, list applicable information about the Americans with Disabilities Act, identify common misperceptions that lead to harmful practices in training and associated inequities and disparities in education and healthcare access, identify steps to establish accommodations and how that applies in the supervisory relationship, and finally, describe ways to reduce bias in supervisory practices. Essentially, this project offers a model to help supervisors avoid biased practices that are harmful against trainees with disabilities and provides guidance in supporting supervisors' efforts to cultivate trainees' development and produce valuable new professionals in their respective fields. First, Dr. Eric Samuels will start with some definitions and statistics about disability in the United States and in the field of psychology.
The 2010 U.S. Census found that 19% of the U.S. population identifies as having a disability. However, the number of psychologists who identify as having a disability is considerably lower. APA's 2015 Workforce Survey of Psychology Health Service Providers found that only 5.8% of psychologists identify as people with disabilities. And though the Americans with Disabilities Act provides protections to individuals with disabilities, how a disability is defined matters. According to the ADA, a person with a disability is a person who has an impairment that substantially limits a major life activity and either has a record of such impairment or is known to have such an impairment. In 1990, major life activities included seeing, hearing, walking, caring for oneself, learning, breathing, and working. And effective in 2009, the ADA broadened these interpretations and added examples of major life activities which included, but was not limited to, performing manual tasks, eating, sleeping, standing, lifting, bending, speaking, reading, concentrating, thinking, and communicating, as well as the operation of several specified major bodily functions. In regards to what a record of an impairment is, an example could be a history of depression, even if it is not currently limiting a major life activity. And regarded as having an impairment, for example, could be a facial disfiguration that doesn't limit a major life activity, but is otherwise regarded as impairing the individual, could be qualified as an individual with a disability under the ADA.
There are two important disability definitions to know. The first is visible disability, which is any observable indication of a functional limitation that impacts daily life and may include physical changes to the body or the use of assistive devices. Some examples are spinal cord injury or multiple sclerosis. Then there's invisible disability, which is any condition, including physical or mental, that may not be immediately discernible, but that impacts functioning or leads to limitations in daily life. Examples are chronic pain, rheumatoid arthritis, traumatic brain injury, but also serious mental illness like schizophrenia.
In order to understand how disability may affect the supervisory relationship, it is first important to understand the unique challenges and socio-political concerns that trainees with disabilities face. Disability is a culture. The most difficult challenges for persons with disability involves the social stigma and discrimination, not the physical or mental challenges associated with the person's condition. Essentially, the biggest challenges of having a disability are the physical and attitudinal barriers that exist in society, not managing the disability itself. People with disabilities are often viewed as pitiable, particularly if they use visible assistive devices such as a wheelchair, or as abusing the system, such as if someone receives accommodations like extra or flexible time on assignments, or work shifts due to chronic illness, such as if the person had ADHD or diabetes. The cumulative effect of such negative attitudes, referred to as microaggressions by Keller and Galgay, leads to the oppression of persons with disability. Psychologists themselves are not immune to bias and prejudice towards people with disability. So, for example, how many of us have flown on an airplane? I'm guessing that's many of us on this call today. How many of us who have flown in an airplane had your legs broken by the air carrier? I'm guessing not a lot of us, but most people who use power wheelchairs have. Even though we have the Air Carrier Access Act, almost everyone who uses a power wheelchair has had their chair broken or mangled by the air carrier, which led to delays or even being stranded. That's what I'm talking about when I talk about the discrimination that people with disabilities experience. It's about having basic rights and enjoyments taken away because of inaccessible environments and attitudes. I'm starting with the premise that disability is an aspect of diversity. To have disability places one in a minority group, not by numbers, because this includes about 20% of the US population, but by social stigma. Social stigma and inaccessibility, both physical, environment, and attitudinal barriers, are the biggest challenges to persons with disability. This perspective is part of the minority model or social model of disability and is the basic values on which this research and this presentation is based. So we add this mix of stigma to supervision. So disability awareness is equal to diversity awareness. So the most important thing for everyone to take away from this lecture is that disability competence is about awareness. Disability awareness is as to diversity awareness. We can give you some good information and a place to start, but really I want to clarify the real message and purpose of this webinar. This is essentially a type of diversity lecture. According to Dr. Gerald Meng Su, the first steps to raising one's cultural awareness is to develop knowledge, awareness, and skills. The only way to really do that is to really wrestle with these issues. So, knowledge, awareness, skills. Now wrestle with that. This webinar can give you a starting point, but you won't get everything from this 60-minute lecture. To illustrate a real-life example of what discrimination may look like in psychology training, we provide several vignettes. Dr. Kimmel will introduce our first vignette.
As I read the following vignette, think about the attitudes and beliefs that caused the following harmful supervision experience to occur. A practicum student with quadriplegia was training at an outpatient mental health center. Intakes at the center involve cognitive and psychological testing. Emma has completed all necessary coursework for intelligence testing and diagnosis and treatment planning. However, due to Emma's reduced hand functioning and fine motor deficits, her supervisor is concerned that Emma will not be able to competently administer the cognitive testing. She will not release Emma to do any testing until she has had time to sit down and watch Emma administer a complete battery. Doctoral interns provide umbrella supervision at this site, and the supervisor has instructed them to train the other practicum students in the tests, but not Emma. Emma's supervisor's biases about disability led her to make assumptions about Emma's abilities. Fortunately for Emma, the interns at the site believed their supervisor was discriminating against her on a basis of disability and went to their training director to report this and determine a better resolution.
And be thinking about what you would do if you were in the room as I go through this vignette. Students with invisible or less visible disabilities might also experience harmful practices during their graduate training and education. Here's an example. Ben is a clinical psychology doctoral student with multiple sclerosis, applying for internship. Due to fear that sites might judge him negatively for having MS, Ben decides not to disclose his condition in any of his internship application materials. John is on the internship review panel at one of the sites where Ben applied. During a review of internship applicants with the review panel, John raises questions about one of Ben's recommendation letters. In that letter, the recommender discussed how well Ben manages his responsibilities while dealing with having multiple sclerosis. John asked the others on the internship panel if the site can realistically offer accommodations for Ben's condition and start guessing at what he thinks Ben would need, like working half days with half of the typical workload, and no integrated assessment reports. The other committee members point out that their site could not take on an intern who needed these types of accommodations. The director of training at the site reminds the panel that a candidate's disability cannot be used to judge an applicant, but also states that it is concerning that the student withheld this information from his application. What else is he hiding? Because of these concerns, Ben's ranking with the internship review panel dropped.
We've now seen two scenarios of how trainees with visible and invisible disability may experience disability bias and harm in the training environment. As we know, supervision is central to training, and there is much research to show that negative supervisory relationships have severe detrimental effects on trainees. The factors that lead to difficult supervisor relationships include insensitivity, bias, and lack of awareness.
Early research on supervision of students with disabilities found that clinical supervision is the worst part of training in psychology for students with disabilities due to prejudicial and discriminatory behavior from the supervisors, of which you now know two real-life examples. They found that supervisors thought that supervisees must prove they can handle their disability in a clinically appropriate manner should they get questions about it from clients or prospective clients. Olkin advocates that supervisors should give supervisees with disabilities the same opportunity to be good, lousy, or mediocre just like any other trainee, and not treat supervisees with disabilities differently.
A very common concern that comes up often in the supervisory relationship is asking trainees to disclose their disability to clients before their first session or during their first session. But why would a supervisor ask a trainee to do that? It's evidence of the common perception that working with a therapist with a disability is going to inherently be bad for the client. However, the research does not substantiate this. In 2011, Daniel Taub and Rhoda Olken studied whether a supervisor should require that their supervisee with a disability should disclose their disability to new clients before the first meeting so that the client is able to decide whether they want to work with a supervisee. They studied legal standards, ethical guidelines, and clinical, professional, and social justice issues. Similar to the research in working with a therapist of a different race, Taub and Olken found that it is not inherently bad for a client to work with a therapist with a disability. But this practice is another example of the barriers that arise in a supervisory relationship for trainees with disabilities.
Literature on trainees with disabilities shows that trainees are reporting concerning experiences of disability bias in their training and in their supervisory relationships. Over 80% of trainees experienced disability-related barriers, including inaccessible training environments and inappropriate pressure to disclose one's disability to clients or prospective clients. A third reported mixed or negative reactions upon disclosing their disability to faculty. These negative or mixed reactions included biased or uncomfortable remarks or assumptions from supervisors and colleagues. Discrimination may occur at every step in the graduate school process. Graduate school applications, practicum training, graduate school coursework and requirements, internship application, or postdoctoral training. And it may take the form of vague forms, lack of accommodations, or outright discrimination, such as barring a trainee from a training experience based on his or her disability status.
So who are these trainees with disability anyway? Well, according to APIC data from 2010, 2011, and 2012 match cycles, the most common types of disabilities reported by trainees were chronic health conditions, learning disabilities, and mental illness. So what do all of these have in common? All of them are invisible disabilities. So having awareness about disability and that disability may be visible or invisible is crucial for all supervisors because any trainee could be affected or become part of this culture, which we hope we have pointed out by this point can impact the supervisory relationship. So students need to disclose to get accommodations and everything will be fine, right? So why is this even a problem? Well, disclosure and asking for accommodations and the right accommodations is actually a very tricky process. To illustrate this, I would like to read you a short passage by Dr. Rhoda Olken's 2011 article, When is Differential Treatment Discriminatory? Legal, Ethical, and Professional Considerations for Psychology Trainees with Disabilities. In the article, Dr. Olken provides a scenario of a trainee with disability in supervision and then writes, navigating the clinical and supervisory issues related to her disability requires exceptional maturity on Sarah's part. She is required not only to learn clinical skills, as are other trainees, but also to be well-versed in her disability and the reasonable accommodations that benefit her. Additionally, she has to be capable of discussing her disability openly and in a non-defensive way, even in light of others' prejudice. Then she has to consider the potential responses of clients and handle those in a clinically appropriate and professional manner. She is unlikely to have any role models in her training related to these tasks. It is not only maturity that is required of Sarah, but more clinical acumen than a trainee is likely to possess at this point. This makes her vulnerable to suggestions or mandates by her supervisor, even if those suggestions are prejudicial, discriminatory, and deeply distressing. This leads us to a discussion about disclosure and reasonable accommodations. It's not so simple. The recommendations are that students must self-identify with disability, ask for accommodations, or indicate a need. For those with invisible disability, they must also provide documentation at the student's expense to establish the existence of the disability, and all parties must demonstrate the need for accommodation. However, in the recent article by Lund, Anders, and Holt described above, 1/3 of those who disclosed their disability reported mixed or negative reactions upon disclosing their disability to faculty. So the only way to get accommodations that a trainee needs is to set oneself up for possible harm or bias, or at least mixed or negative reactions from supervisors or those in authority over them.
Supervisors may harbor disability biases that vary across disabilities. Just because you aren't biased towards one disability doesn't mean you won't be biased towards another. Countertransference issues in supervisory relationships with students with disabilities. Like clients, supervisors may become overly concerned about a trainee's welfare or feel a sense of having to care for them. Results from a research study recently submitted for publication by Dr. Wilbur and myself show that supervisors rated themselves as feeling not competent to supervise students with disabilities. They felt overwhelmed and they were concerned about trainees meeting expectations. Also, if a trainee teaches a supervisor about their disability, the natural power dynamic is shifted. Supervisors may feel discomfort and begin to react defensively to the trainee, and disability biases can emerge.
Unfortunately, supervisors often tell their supervisees to disclose their disability to potential clients before the first session. My own experience is represented in this vignette. As I go through this vignette, consider the following question. Recognizing that supervisors have power over their supervisees, how should a supervisor handle the situation in the future in order to create a more collaborative relationship? Eric is a clinical psychology doctoral student in his second year who has Tourette syndrome that manifests itself in facial tics, grimacing, and movement of his head and neck. Eric starts his second-year clinical practicum at a community mental health agency after having not disclosed his Tourette's during the competitive application and interview process. In his first meeting with his supervisor, Eric discloses having Tourette's to his supervisor. His male supervisor responds that he would like Eric to disclose having Tourette's syndrome to every single client that Eric is assigned to work with during the first session of therapy. His supervisor expresses the concern that Eric's potential clients might be bothered by his tics and have a right to make an informed decision as to whether they'd want to continue working with Eric as early in the therapeutic process as is possible. As this is all occurring during Eric's first meeting with his new supervisor, and due to the fact that he's only a second-year student in his program, Eric is not sure how to respond, and he obviously worries about how his supervisor might respond to him if Eric were to push back on this request or file a complaint with the training co-directors. In order for any of the accommodations to work, trainees must first identify with having a disability, which in itself may not always be easy, especially in the case of individuals with invisible or less visible disabilities. Some disabilities may be more culturally acceptable, like depression, than others, like substance abuse. Disabilities as well may fluctuate, as is the case with chronic pain. Ultimately, different factors impact a person's disability identity. These factors can be personal and cultural, as well as a person's actual disability. For people who have invisible or less visible disabilities, their ability to pass as able-bodied might afford them protection from bias and discrimination from society. However, these people might have more difficulty accessing accommodations and will have to constantly disclose their identity to others in relation to people with visible disabilities. The decision as to whether or not to disclose is a constant struggle that people with disabilities have to face. And how a supervisee identifies with their disability can have a varying amount of impact upon their training experience. Ultimately, students with disabilities need to make decisions about whether they want to disclose their disability to supervisors and clients and whether they want to request accommodations. When they think about whether or not they want to do this, they will consider how they believe that their request for accommodations will be received, and whether this disability can be accommodated at all. The ways in which they identify as having disability might also impact their ability to develop a necessary support network that they'll need to get through the challenging demands of a doctoral program. Their disability might also impact their professional views of themselves, as well as their thoughts about professional opportunities that will be available to them. They'll wonder about how their disability might impact their work with clients.
Identity is different from adjustment. For example, a trainee may completely identify with having a disability and feel completely integrated with that identity, but experience bias or are denied reasonable accommodations or are stressed from experiencing discrimination or prejudice. This is not an adjustment problem or an identity problem. The supervisor's role is to understand the factors that influence the trainees with disabilities' identity development. What happens when supervisors use clinical concepts to understand their supervisee's disability? Well, this is a cause for multiple relationships, boundary disturbance to form, or even a conflict of interest, and the impact on the trainee with disabilities is belittling.
Let's talk about reasonable accommodations and the cultural challenges attached to them. I will start with a quote that serves as an example of a common type of bias about reasonable accommodations. This came from an article about social barriers for university students. In this case, a student with a learning disability received extra time for testing, a very common type of reasonable accommodation for this type of disability. And the reaction from the teacher was, "You get extra time on a hard exam? Oh, aren't you lucky?" Suggesting that the student with disability is getting special privileges or some kind of unfair advantage. But as Dr. Rhoda Olkin pointed out in her 2010 article, The 3 R's of Supervising Graduate Psychology Students with Disabilities, Reading, Writing, and Reasonable Accommodations, altering how standards are met does not lower the standards themselves. As long as trainees are able to demonstrate that they can meet the standard, how they do it, including with reasonable accommodations, does not lower the standard or give trainees some type of pass. This is not about producing unfit clinicians. This is about diversity and leveling the playing field. Here's another example. Mary is a postdoctoral fellow whose rheumatoid arthritis affects typing for long periods. She discloses this to her primary supervisor and asks for a reasonable accommodation, access to dictation software, and a private space in which to dictate for confidentiality. Her supervisor follows up with the office manager to obtain the necessary software. The office manager refers the supervisor to the institution's Equal Employment Opportunity Officer. The EEO officer then asks the supervisor to obtain permission from the department head, which the department head grants. The request for space is denied and the software does not arrive. Meanwhile, the fellow feels forced to use their own equipment, which goes against the institution's policy, in order to complete clinical documentation. After 5 or 6 months pass, the EEO officer tells the supervisor that additional paperwork must be submitted by Mary's medical provider because the disability is not visible. The fellow submits the documentation from her medical provider, but the accommodations are still not yet supplied for another 6 months. During this time period, Mary follows up with her supervisor on a weekly basis about the issue. The supervisor realizes that he does not know the accommodation process at the institution. He consistently responds to Mary's questions, that he has asked about the accommodations and is still awaiting a response. However, he's uncertain about how to advocate for Mary's needs more successfully now that his supervisors have said no or have not responded to his requests. He is uncertain about the best course of action to establish reasonable accommodations and move forward. The above vignette provides an example of how challenging it may be for supervisors to obtain reasonable accommodations for their trainees at their institution. Many psychologists think that the trainee is the person who is responsible for getting the accommodations in place, But as shown in the vignette above, it may be that the trainee does not have the power to do that, and it falls to the supervisor. And then it is the supervisor who needs to know how to navigate the system in their institution, which may not always be as straightforward as one would hope. Many psychologists and supervisors also expect trainees to know exactly what accommodations they need, but different training levels may lead to different accommodation needs. For example, during graduate school, students may be able to arrange their schedules to take breaks and use pacing, but there may be a more rigid, structured schedule at internship. The reaction from supervisors and gatekeepers may be, well, but that's how they must prove that they can cope in a real job. However, not all jobs in psychology are the same, and having different hours, schedules, accommodations in and of itself does not make one a danger to the public. Again, altering how a standard is met does not lower the standard. Trainees may not have sought reasonable accommodations in the past and just overcompensated without accommodations, but may begin to struggle as the intensity of educational requirements increase. Therefore, trainees may not know what accommodations they need until they're there. The idea that a trainee must disclose up front right away assumes that accommodations will be the same at all times and in all situations. And we know that that is not true because circumstances, environments, demands, and disability changes. Disability itself is not static. It changes whether due to chronic pain, assistive equipment breaks down, new medication side effects, or other elements of disability. Finally, students may experience consequences when accommodations are delayed or not in place. Research indicates that often students with disabilities commonly underutilize resources and accommodations, especially in professional settings. They may hurt themselves or their clinical work may suffer. The contributing factors to this are thought to be that students underutilize resources out of a desire to be equal and to be seen as comparable to their non-disabled peers, and to refute bias and bias about those who use reasonable accommodations. So in talking about reasonable accommodations, it's also important to consider the institution and the culture of that institution. Another barrier to obtaining reasonable accommodations may be related to the institutional cultural bias. So for example, an institution may advertise a 40-hour work week, but the institutional culture expects a 70 or 80-hour work week. In this case, a trainee may think that with accommodations, they can meet the needs of the institution, not knowing the institutional culture ahead of time, and may set the trainee up for possible failure. Also, obtaining reasonable accommodations may be very different between institutions. For example, persons with invisible disabilities may be required to prove their worthiness in obtaining reasonable accommodations by submitting additional paperwork from a medical provider, which is not necessarily required of their visible disability peers. Trainees who have just moved for internship or postdoctoral fellowship who are required to obtain this type of medical documentation to receive an accommodation may be in a really tight spot because it may take months before they're able to see a provider or specialist who can provide the requested documentation. And again, the attitudes of people, including psychologists who work within an institution, may be colored by the culture of that institution. This causes a type of disability bias trickle-down effect. Some of the most common biases that may include some of the following. Comments such as, is your disability that bad? Are you sure you can't just use what's there? Well, how did you get this far? Well, haven't you always been providing your own accommodations? Really, all these comments just send a message of devaluing the student. Not only are these questions a type of microaggression, but the attitude may lead to delays in establishing accommodations, which in and of itself leads to serious self-doubt, lack of growth, and detriment to qualified students.
So one of the things that we hope you do as a result of this lecture is work to develop a disability affirming environment. So how do you do that? By increasing disability awareness. That's knowledge, awareness, and skills. You can do that through self-exploration of your biases, continuing education, consultation. We strongly advocate that training directors and psychology leaders seek opportunities to raise awareness about working with trainees with disabilities among the clinical supervisors on their staff. Know the accommodations process at your institution. If supervisors want students to disclose, they must provide a safe place for them to do so. And one way to do it is ask everybody about accommodations. So what do supervisors do if students don't disclose? Often, disability only comes up if a trainee starts to struggle. This should be one of the first conversations after the trainee has been accepted to the program or site. Don't ask everyone if they have a disability. That question is technically illegal. It is important that early in the beginning to identify your role as a supervisor and facilitator in navigating the new environment. All trainees will have questions or things they don't know at the very beginning of any new supervisory relationship. Acknowledge and state that this includes helping trainees seek and establish accommodations if needed. You can phrase it however it feels most comfortable for you, but include, I am also the person who would help you establish reasonable accommodations if you needed them. If you ever need reasonable accommodations, please let me know. And finally, supervisors must be advocates for students with disabilities. So whose responsibility is it to help the supervisor examine his or her attitudes about disability? Well, it's the supervisors. And supervisors should engage in self-reflection to be aware of their own biases. Olkin establishes that educators bear a responsibility for serious introspection and offers questions to guide them. Can also seek consultation with your colleagues. We found that there are benefits to when students disclose disability, including to the supervisory relationship. Supervisors whose students disclose report it's beneficial to the supervisory relationship. There's also benefits in terms of APA accreditation for training sites. If students don't disclose, programs can't highlight disability as part of diversity. Finally, the aspect of positive experiences. Supervisors who supervise students with disabilities report positive experiences working with them, including increased consultation, networking, and professional growth.
So when is it appropriate for supervisors to ask a supervisee to talk about their disability? We encourage you to consider the social minority viewpoint as a rule to follow here. You can insert another diversity variable when considering the importance of requiring trainees with disabilities to disclose their disability. The law stipulates that disability information is shared only on a need-to-know basis and only if it furthers supervision. However, even a disability-affirming environment does not guarantee that a student will disclose or respond to questions about their disability.
The following vignette is another real-life example to highlight the importance of asking about disability accommodations in the beginning rather than waiting until a trainee is struggling. A supervisor is very frustrated with an intern whose reports and psychotherapy notes are very slow to come and then repeatedly full of spelling errors. She has recently asked the student, "Do you need disability accommodations?" twice, and the student has declined. She brings her concern to the training committee, and the committee recommends that she give the student negative ratings on her upcoming evaluation. She is not sure what more she can do. The truth is, this is exactly what will not lead to disability disclosure when you have a frustrated supervisor and a defensive student.
As described above, while a supervisor cannot make a trainee identify with having a disability or accept reasonable accommodations, it is recommended that they have a conversation about the issues that are arising in the student's work. Disability could be listed as one potential contributing factor, or merely point out that if reasonable accommodations were ever needed, that the supervisor would be the person to coordinate this. If disability is something that the trainee does identify with, encourage the trainee to get support. To trainees, we say, find your people. There are virtually no specific resources available. However, there is SIG, the Special Interest Group Psychologists with Disabilities. Students may also start their own support group for persons with chronic illness and disability, or build a support network. One avenue may be to get in touch with CDIP, the American Psychological Association's Committee on Disability Issues in Psychology. As a supervisor, if you work with a trainee who is struggling and you suspect that disability may be a part of the picture, ask the trainee if reasonable accommodations may be needed and encourage the trainee to be part of creating a solution and developing the reasonable accommodations. Talk about how the trainee can self-advocate and ways to approach challenges to obtaining reasonable accommodations. Remember, accommodations are not a guarantee of success, but are there to level the playing field.
And so we give you more information about the special interest group in APA Division 22, Psychologists with Disabilities, that is led by Dr. Erin Andrews, and we give you Dr. Andrews' email address. Division 22 also has a mentorship committee, which we provide their website, and the contact for that is Dr. Mary Brownsberger, as well as the website for the American Psychological Association's Committee on Disability Issues in Psychology.
So how can a supervisor communicate openness and recommend accommodations to a supervisee with a disability who has not requested them or does not want them? Recognize that disability identity and acceptance may play a role. Normalize accommodations. Understand that trainees want to be seen as comparable to their non-disabled peers, and remind them that altering how a standard is met doesn't alter the standard. Reframe accommodations. A supervisor could reframe accommodations as routine ways of maximizing chances of success. Take a strengths-based stand. And finally, encourage trainees to look to future sites on how they will self-advocate when they are independent practitioners. If they are having difficulty now, it's possible it will follow them, and it is in their benefit to explore all their options now.
On the whole, we encourage supervisors to treat disability as any other diversity factor in supervision. We encourage every supervisor to ask if the trainee may need accommodations early in the supervisory relationship and continue to check in. As noted above, one way we encourage this is for every supervisor to open the door about disability at the beginning of the supervisory relationship. This could be as simple as, also, I let all my trainees know that if you should ever need reasonable accommodations of any kind, please let me know. I'm aware of how to establish accommodations at this institution and would be the primary person to do that. Be aware that disability needs may change over the course of training and that accommodations may need to correspondingly change. Be aware that trainees may not know what accommodations they need until they're in the situation, and it will be the supervisor's responsibility to help coordinate and establish accommodations.
Our final point is a call to action for supervisors. We strongly advocate that training directors and psychology leaders seek opportunities to raise awareness about working with trainees with disabilities among the clinical supervisors on their staff.
Supervisors, you can be an instrumental factor in making these changes and creating a disability-affirming training environment. We also strongly encourage supervisors to become more aware of trainees' concerns around disclosure and work towards developing a disability-affirming environment.
Remember, altering how standards are met does not lower the standards themselves.
We wanted to leave you with a final quote by Dr. Samuels. We chose this quote to end this lecture to provide a window into what we have tried to convey here today and our hope for what disability and training can be for the future.
So I originally wrote this in a blog post for the APA newsletter about my experiences and challenges in psychology training as a person with a disability. Going through internship interviews and clinical supervision, I had sometimes felt that the focus was primarily on my Tourette's. A focus on my strengths and capabilities rather than my disability would make me feel more welcome in the profession. We would like to thank everyone for attending, and we will now take questions.
All right, thank you, Dr. Samuels. Thank you all to the presenters. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit questions through the questions pane in your attendee control panel. So it looks like our first question is, what other suggestions do you have for a training director that wants to create a disability-affirming environment? Dr. Wilbur, do you want to start?
I think that one of the important things are kind of what we've mentioned here. Certainly including disability as part of training, perhaps in lectures series that are given to both trainees as well as to supervisors. In some institutions, there is like a supervisor kind of ongoing supervisory issues group that they have. And I would encourage training directors to include disability as part of that, as something to consider as part of the disability environment and in the supervisory relationship. And maybe Angela could also offer some insight, since she is also the assistant training director at the Cleveland VA.
Sure. So I was just going to suggest, we've got a great reference list and we quoted some great articles throughout the presentation today. Use those for journal clubs with supervisors. Send those out for readings. And echo what Dr. Wilbur said about making sure your supervisors get to see a presentation like this.
Yeah, I totally agree with what Dr. Wilbur and Dr. Kumil are saying. I was going to say what Dr. Kumil was just saying just now in regards to just, seek out opportunities to enhance your knowledge and awareness about these issues. We've name dropped Dr. Rhoda Oken several times, as well as people like Emily Lund, Erin Andrews, and so forth. These are preeminent people in our field who have written a lot about disability issues within psychology and within training communities. So reading any of their materials will take you a far way in regards to enhancing your knowledge and awareness of these issues, which would then hopefully make you a more disability and affirming training environment.
All right, thank you. We have another question I just want to answer really quickly. Someone asked, are the complete references going to be available? Yes, we're going to upload this presentation to YouTube, and you're going to have a list at the end of this PowerPoint of the full set of references. So thanks for asking. Great question. We have another question that says, can you say more about how a standard is met and it doesn't affect the standard?
Well, for example, in some cases, there may be a disability where extra time is needed. So, a great example that Dr. Olken gives in one of her articles was, for example, someone with spinal cord injury may have to do bowel program in the morning, and maybe it doesn't go as planned. And so the trainee may not necessarily get to a site on time in the morning. And that in and of itself does not necessarily make one a danger to the public, but having maybe flexible hours that will be able to fit, dovetail well into, what the trainee can do, but also being mindful of accommodations. So, some of it, like, a lot of the examples for reasonable accommodations include things like, extra time on tests for someone with ADHD or some kind of learning disability as part of their disability. And, the student still has the opportunity to demonstrate the knowledge and the skill. The purpose is to still be able to demonstrate that they have the capability. They still have to meet the standard. But having extra time, because of attentional difficulties, doesn't necessarily mean that the person can't meet the standard. It's just meeting it in a slightly different way.
Yes, that's a really comprehensive answer. I don't have anything to add.
And
Okay, we have one more question. Doctors Kimmel and Wilbur, would you be able to share a little bit about your research?
Sure, that would be great. While I was at the Cleveland VA doing my postdoctoral fellowship, I worked with Dr. Kimmel on my research project there, and we were curious about the knowledge and awareness of supervisors in psychology across the country in terms of how well they were familiar with disability issues and reasonable accommodations. And so we developed a anonymous online questionnaire for supervisors to answer, and it came in 3 parts. The first part was just a demographics questionnaire to kind of understand the population that responded in terms of things like where they were located, what populations they served, institutions that they were a part of, and also what division they were a part of, because we were curious if people, for example, from the rehabilitation psychology division or health psychology might have more awareness around disability issues than maybe someone from a research field or something like that. And then the second section really looked at just basic yes or no kind of questions about awareness about disability, what is a reasonable accommodation, knowledge about the Americans with Disabilities Act. And then the last section was one of 2 possible vignettes. Both vignettes were exactly the same. They both described a trainee who had previously been doing well at their site and now were exhibiting some difficulties. In one of the vignettes, it mentions that the student is a lifetime wheelchair user, and the other one doesn't mention anything. And the purpose of that was to see if the responses in terms of how the supervisors would respond to the issue related to whether or not they had any awareness around this being related to disability. So the one that doesn't mention anything about disability was an invisible disability vignette, and obviously the one that mentions that the trainee was a wheelchair user was the visible disability vignette. And we found some amazing differences in terms of how supervisors would handle the situation just by the simple fact that one of them mentioned that one was a wheelchair user. So we knew that there was some misunderstanding among our supervisors, and we felt it was really important to try to understand that. Where are the places where we have some holes in our training for our supervisors, and how can we best support them?
All right, great.
Yeah, the only thing I want to add real quick is, Dr. Wilbur talked about the biases in the supervisors treating visible and invisible disability better, but they were also incredibly confused about a disability accommodations.
Yes, that was also very clear from our research. So we're hoping that this webinar and future research and publications will be able to offer supervisors just more resources, more education, and hopefully to be able to kind of change some of the culture in psychology in general around disability issues.
All right, perfect. Well, thank you so much to our presenters. Thank you for everyone for attending today's webinar. You're going to receive a follow-up email with a link to view the recording of today's webinar sometime this month, as well as a survey on the presentation and a way to contact the presenters if your questions have not been answered today. We'd greatly appreciate if you would complete that and provide your feedback. On behalf of APA and our presenters, thank you so much for joining us today, and have a great rest of your day.